Many of you told me about your stories with PCOS, and every time I hear about your experiences with your symptoms, with the ignorance you experience from your doctors, about delays in your diagnosis, or about lack of information about treatment options, I can relate so much. And today it's time that I share with you my PCOS story. So get your popcorn ready and let's start it. Welcome to Holistic Ovaries. I'm Agnieszka, and every week I post new videos about PCOS, about management, the stories, tips. So if you want to learn more about it, subscribe to my channel. My PCOS story starts with acne, those big, painful, deep cysts all over my face, especially on my chin area. So, as it was the skin problem, I went to dermatologist. I was prescribed antibiotics and I was sent home. I was taking antibiotics for 3 months. They did not have my acne. Then most probably they just make the damage to my gut microbiome. And then the acne did not disappear and I still didn't know why do I have them. As I was doing my research, I found out that type of acne, the most probably is a hormonal acne, and that contraceptive pill can help me. I was a little bit reluctant to that idea, but I was 24 years old and I did not want to have acne. My self-confidence was really affected by that. So I went to gynecologist, I was prescribed the hormonal pill, and here, without any blood test, without any diagnosis, without anyone telling me what's going on, without anyone telling me side effects of hormonal pill, so I just went home still without knowing that I have PCOS. On the pill, my acne started to disappear, but I did not feel like myself. I was anxious, my mood was changing, I was out of energy, but that was really the price that I was willing to pay to not to have acne. And many of you who struggle with acne, I'm sure, can relate to that. Acne is still stigmatized, and research shows that many people who struggle with acne have lower quality of life and suffer psychological disturbances like anxiety or even depression. And I really can understand that. But after a year on the pill, I decided that I want to heal myself in more natural way. So I stopped the pill, and here the roller coaster starts. My acne come back worse than ever. I start to gain weight, especially on my belly area. My hair was just falling out, and I started to grow hair on my chin, and my period completely disappeared. And that was what was going outside of me, but inside I felt horrible. I felt out of control and so hopeless. And the worst part was that I still didn't know what was going on with me. And I went like this for months trying to find answer in any possible place. So I went to naturopath, I tried acupuncture, I tried Ayurveda, I even went to shamanic healing. I tried many different herbs. I was told to eat nuts, not to eat nuts. I was told to be vegan, not to be vegan. I was told to be on keto, not to be on keto diet. Total confusion, and my symptoms was only getting worse, and I still didn't know what was going on, and my period was not coming back. Finally, in Mexico, I went to gynecologist, and she told me that I have PCOS. So it took me almost 2 years and literally hundreds of kilometers to be diagnosed with Polycystic Ovary Syndrome. And I know that it is not only my experience. Research has shown that it takes almost 2 years and on average 3 different professionals to establish diagnosis of PCOS in almost half of PCOS patients. Even though I felt relieved that finally I had a name to my symptoms, the only solution I was told by gynecologists was to take the hormonal pill and to lose weight. And I need to mention that I am 160 centimeters, and that time I was 60 kilograms, so the same like now. And still, the solution I got for my PCOS was weight loss, without any explanation how to do it. And anyone who suffers any hormonal imbalances know that losing weight is very challenging, especially when approached by yourself. And at that point, I did not have my period for almost a year. My acne was all over my face, and I was just tired, so I went back on the pill. And I focused on losing my weight. So I tried every possible diet, you name it, vegetarian, vegan, lactose-free, gluten-free, low-carb, fat-free, keto diet, everything. And what all these diets have in common is restrictions. And additionally to that, I started to practice intermittent fasting. And for people who don't know what is intermittent fasting, is when you have restricted window of feeding time, let's say from 10 a.m. to 6 p.m., and you don't eat for the rest of the day. I become very restricted with my eating habits to the point that I stop eating for a few days. And on top of that, I start to exercise very intensely. And yes, I lost weight. And at the beginning, yes, I felt amazing. I felt in control. And because I was on the contraceptive pill, my physical symptoms were not there. So fantastic, you may say. But something was not right, because after a long period of restrictions, exercise intensely, I have my first episode of binge. It was like my brain switched off, and I could not get back control over my body and over my mind. And after the binge, the feelings of guilt, shame, and hate to myself were just overwhelming. So I started to restrict again and binge again. It went like that for a while, to the point that most of my thoughts were focused around the food, my body, my weight. What did I eat? I shouldn't eat that much. How much I weigh? What would I eat? You can imagine that my life was a mess. And when I realized that, it was like a punch in my belly. What am I doing? Do I really want to live like this? The answer was no. I was already emotionally exhausted, physically exhausted. I felt lonely, and I just had enough. So I changed my priorities when it comes to my health and to PCOS management. I started to learn how to eat in balanced way without restrictions, how to move my body the way that was pleasant for me, not because I have to lose weight. To manage my PCOS, I focus more on the emotional side, how to manage my emotions. I focus more about how to sleep better, how to manage my stress response, how to get into the relaxation. So completely different approach. And then I stopped the pill the second time. And yes, my symptoms come back, but less intensely. And after 8 months, I got my period back. And now my menstrual cycle is regular, between 28-32 days. I ovulate. I get some pimples occasionally, but I don't suffer the surf acne. I have a little bit of belly fat, but I really don't mind, because I would never again enter the loop of dieting and disordered eating habits. And now, from perspective of time, I'm happy that I went through that journey, even that it was very difficult at some time, but it gave me a chance to try many different things, to make my mistakes. And even when I went to study PCOS in the university. And if a few years ago you asked me how to manage my PCOS, I would tell you, don't drink coffee, don't drink alcohol, be on keto diet, don't eat gluten, be lactose free, eat only between 10 a.m. to 6 p.m. and exercise a lot. Everything based on restriction without taking into consideration your unique PCOS needs. And now I know that managing PCOS is a process that needs to include many different factors and need to be personalized to each PCOS woman. Now you can work with me to create your own PCOS strategy. You can book free consultation and you will find the link in the link description, and you can share your story with me and other women in the comment section, or you can send me the message on Instagram. I will be very happy to hear from you. Remember to subscribe to the channel to support our PCOS community, and I will see you in the next video. Bye bye.